Hello, this is Dr. Jack Bielitz, and welcome to another exciting episode of the Ask Dr. Jack Show, where we answer the questions that you ask. Let's get this out of the way right now. I am not a medical doctor. I'm a chiropractor sitting here in Omaha, Nebraska. I'm not here trying to give you medical advice. I am here giving you amazing information that you can use to decide and make decisions about your health and the rest of your family's health. Okay, that's out of the way. Today, the topic is cholesterol, and why so many people that are quote-unquote experts are so far behind the times as to what is going on. So the thing that brought this up is I had a patient who recently got a blood test for an insurance policy, and it came out that she had high LDL, which is the bad cholesterol, and so the insurance company decided they wanted to raise her rates because of that. And you know what? The problem is that idea that the LDL is so important as a risk factor for heart disease is so outdated. It's 10 to 20 years outdated. The problem with the experts is that they want to see long-term results before they actually change their official standings on things. And it can take that long to make it. So they're using ideas and data to base their actuarial tables on information that just is really horrible predictors of whether or not somebody's going to get a heart disease of some sort. So the fact is, the biggest factors that we know of today that predict heart problems are a strong family history, high triglyceride with a low HDL level. That's the good cholesterol. High blood pressure, decreased cardiovascular conditioning, in other words, being out of shape, obesity, and an elevated oxidized LDL cholesterol. So not the LDL, but the oxidized LDL is a much better predictor of having heart problems. So if you have any of these, it's probably a good idea that you do something about it so you avoid a heart disease problem. So first of all, the first thing you can do, drop your weight. How hard is that to figure out? If you're overweight and you have some of these other factors, you got to get rid of the weight. It's a problem. It's something you have to deal with. We can help you with that if you need it. The next thing is get in some cardiovascular shape. So you can easily drop weight by just cutting calories, but if you also increase your cardiovascular abilities, then your whole body is going to really, really be better off for it. So getting some exercise in and increasing your cardiovascular level is much better. If your triglycerides are too high, you make sure that you eliminate the carbohydrates and take some fish oil. But we are finding out that carbohydrate intake and cholesterol levels go hand in hand. It has nothing to do with the eggs that you're eating. It has nothing to do with the red meat that you're eating. It has a lot more and a greater deal to do with the amount of carbs. So you need to cut those things down or eliminate them as much as possible. Fish oil is an amazing product, but you got to have some good stuff. You can't just go to Walmart or Walgreens or whatever and get it because they just don't make a quality product. And even at stores that carry quality products don't necessarily mean that all of their products are quality. So go someplace that you trust, a No Name, a Whole Foods. If you're really at a loss and you really want some help on this, we've got some great stuff here at this office. I'd be glad to help you out with it. Check your oxidized LDL levels. Now this is particularly for people that have a big concern about this. We can order a test here. If you don't want to bother, you go to your doctor if you want. If you're going to be having an appointment anyway, great, go for it. Tell them you want an oxidized LDL test. If you don't want to bother him or her, then come into the office and we can order the test for you. We can get the information and figure out where you're at. Another thing that has a huge effect on your cholesterol, heart disease, all that stuff, is, believe it or not, your sex hormones. Yes, I know they're for sex, but they're also for a lot of other things. So get a test on those also and see where those levels are, and maybe you need to have some help with that. And the last one, control your blood pressure. 9 times out of 10, doing the other ones that we talked about is going to take care of that problem, because blood pressure goes huge into cardiovascular health. It goes huge into the amount of carbohydrates you're taking. It also is very much affected by sex hormones. But if it's still a little higher than you want, stop in for an exam. Possibly the nerves going to that cardiovascular system are not functioning correctly, and it's causing you to have an artificially high blood pressure, in which case we open up those nerves, your body starts functioning right, and your blood pressure starts coming down. It's a lot better than having it come down with some stupid drugs. Anyway, I hope you got a lot out of this episode. I know there was a lot of great information in here. You might have to reread it again, re-listen to it again. If you have any questions, please call our office, 402-333-4848. We can help you with the weight loss. We can help you with the dietary concerns. We can get testing for you, and we can check your body to make sure that all of your nerves are working properly so that you do gain a really proper health. I mean, let's face it, you're going to have to die. But if you take care of these things, it's going to be far more likely that you die of some tragic accident rather than a prolonged stay in a hospital due to a cardiovascular issue. And that's what we want. We want you to have a good, quality, long, healthy life. If you have any questions that you would like us to look up, please email me at askdrjackb, that's B-E-E, @gmail.com, or call the office, again, 402-333-4848. Be glad to answer those questions, or just stop in and ask us in person. That's why I love it the most. Hope you have a very happy, healthy day, and I just can't wait to see you on the next episode of the Ask Dr. Jack Show.